On behalf of the entire Kellogg Institute, our director, Paolo Carrozza, and our new Ford Program Director, Patrizio Perrin, let me welcome you to this special Ford Research Seminar entitled Adapting Research in Times of COVID-19. With the advent of the COVID pandemic in the spring of 2020, academics worldwide were forced to adapt to a suddenly new and dynamic research landscape. We were all compelled to develop new research strategies around disruptive and sudden changes. Ford program-sponsored researchers face these challenges and some additional puzzles. One reason for this is that their research projects incorporate the concept of integral human development, also known as IHD, and IHD's holistic model of flourishing rooted in a person's dignity and full potential. In the wake of COVID, this morning's panel of researchers were faced with navigating the very real human issues of research, especially those faced by local partners and participants, in addition to the practical research questions about methods. With COVID, social distancing and travel restrictions disrupted established modes for access and human interaction. For research premised on meaningful partnerships with local communities, as well as scholars and policy practitioners, this was a significant challenge. COVID's economic dislocation prompted geographical relocations and a changing makeup of some local communities. For research focused on understanding the challenges and the aspirations of people living in extreme poverty in the developing world, this raised important concerns. COVID-19 also simply added new layers of vulnerability in already at-risk communities partnering with researchers. The real human concerns and needs here had to be navigated simultaneously with practical questions about project design, data collection, and analysis. This morning's panel discussion will explore research adaptation undertaken in several IHD projects sponsored by the Ford Program in Human Development Studies and Solidarity. We'll hear about how these researchers have been able to navigate and to adapt their research to meet human-focused challenges, as well as the practical challenges imposed by COVID-19. These are, I believe, a compelling set of stories about research continuity and preserving the human dimension in IHD research during a very challenging time. Our format for today is rather simple. Our four fantastic presenters will provide us with insights into their projects, the challenges they faced, and the adaptation and innovation they implemented in the face of COVID-19. After their presentations, we will open the floor for your questions. If you have a question for our presenters, please post it in the Zoom chat, as Teresa has noted, and we'll take as many questions as possible before our time ends at 10 o'clock. Before I introduce our presenters, let me also offer our thanks to the Kellogg Institute staff who are making this morning possible, especially Teresa Hanlon, Karen Joseph, and Karen Clay. While my introductions here will be brief, you can find fuller biographies of all four of our panelists on the Kellogg Institute website or by clicking on the event page for this panel discussion. Our panelists this morning are John Onyango, Associate Professor of Architecture and a specialist on humane spaces and architectural designs that foster positive development outcomes. John is joining us from Costa Rica. Jackline Aridi, the Regional Research Programs Manager for East Africa at the Ford Program and a specialist in health system management. Jackie is joining us from Nairobi, Kenya. Wyatt Brooks, Associate Professor of Economics at Arizona State University and a specialist in international trade and development economics. Wyatt is in Phoenix, Arizona, where it is warm and sunny. And when he brags about the weather, we just don't speak to Wyatt. And finally, Paul Perrin. Paul is the Evidence and Learning Director at the Pulte Institute for Global Development and an Associate Professor of the Practice in the Keough School of Global Affairs. Paul is coming to us live from good old South Bend. With that, John, let me pass it off to you, and please start us off.
Thank you. Thank you very much for inviting me to be part of this discussion and conversation. As you heard, my work in architecture looks at integral human development and also issues of sustainability and human life. So this project in particular is something that came up with a collaboration between my team, Nicoletta Setola at University of Florence in Italy, a team also from Bournemouth, Iannuzzi, Laura, and also here at Notre Dame, we have Paul Perrin and also Vania Smith. We all come from very different backgrounds, looking at all this issue of maternity and human development and the issue of dignity. Maternity spaces are places where we were born. All of us were born in one space or the other. And there are challenges in some of those spaces where human dignity can actually be compromised. And in particular, we know that in developing countries, those challenges are quite severe. And therefore, through partnership with Brother Andre's clinic in Nairobi, we approach to look at how we can improve human dignity for women and children who have been born in those facilities and other facilities within Kenya in particular. And thankfully, we had Jackie, who's been working with Ford Foundation in Nairobi, who came in to really support our work in partnership with them. So for us, when we began the project, we had hoped to have meetings, team meetings, we call sandpits, to discuss the framework on human dignity from different perspectives, from perspective of sociologists, anthropologists, epidemiologists, and architects as well, to see ways in which you can improve human dignity of mothers who are giving birth and those of the children who are born in those environments, and looking at interrelationship between those taking care of them and also the family, and how they can relate to improving their life in those facilities. However, COVID hit very quickly, and our plan to have the meeting in South Bend could not take place because travel just got restricted. And we quickly adopted by looking at ways of virtual meetings. So we decided to have several virtual sandpit meetings with the team at different times. Zoom is very tough to discuss things individually because sometimes you can't see the dynamics, the chemistry, but we worked very well with that. So the team was able to have Zoom meetings going on with the team from Italy, team from the UK, team from Nairobi, and from Notre Dame, meeting several times to look at this. So in our case, pivoting in terms of just changing the physical meeting to virtual meeting was very critical for us to look at this. And then secondly, we realized very quickly that we had to rely heavily on partnership with our team out there in Kenya. And Jackie was very helpful through Strathmore University, that we have worked with them, at least at Ford Foundation, I've worked with them several times. And because of the relationship that's been building for some time, Jackie was able to provide us with a lot of information on literature review and also data on public health in Kenya that we would not have otherwise be able to find or to be able to get. Because normally when you travel there to get any information, the first thing they will ask you is, do you have a research permit? If you don't have, they want to talk to you. So Jackie, being on the ground and already working on the ground, was able to get us access to several things that we required for our research. Thankfully, because of this partnership, our ethical approvals process began. And normally feedback can take as long as 6 months to get the first feedback. In our case, because of partnership, we got our first feedback about a week ago. It took only about 3 weeks. So we're grateful for that partnership, which is really, really critical in this kind of research. Secondly, looking at also approaches, because things have changed. How then are we going to carry out the research? Because part of the plan that we had was to go and interview the women who are there, interview the doctors who are working in the clinic, interview the nurses who are working in the clinic, to figure out how they relate to one another. And because we cannot really travel there, interviewing becomes very challenging. So we have decided through conversations with our team that we will rely heavily on our partners who are out there. Jackie and her team have already translated some of the documents into Swahili, which is very helpful. And we'll rely on them to carry out some of the interviews on our behalf. Now, it does raise some of the issues in terms of ethical issues and trust, but because of the relationship we've been working with them, we have trust in them. We have trust that they will uphold the same ethical standards that we have here. Especially we trust Jackie because she is already working through Notre Dame in this matters here. And therefore that's something that we know we can be able to get the same source of information that would otherwise have gotten had we gone there. And the other thing that we have come out with over these times is to rely on something called digital collaboration dashboard. It's called Miro. Miro is a very good dashboard that allows collaboration. We can add pictures to it. We can add text to it. And we hope to build this further and allow our co-design process to occur with the women who are out there by using the same images on the dashboard. And this can be seen on a phone or on an iPad that the team down in Nairobi can actually show them and allow them to move things across from place to place. We rely more on pictures and images to show them spaces and to figure out what they might find provides them the dignity that they need compared to what they have right now. We hope that things may change. We don't know when things can change, but if they do change, we will definitely be able to travel to Nairobi to be with them in person, because human dignity requires in-person relationship, which is very, very critical. So we are looking forward to continuing working with them. We're looking forward to building trust. And we're grateful for Ford Foundation because without the link to Ford Foundation, the Kellogg portion of the grant could not really be successful. So Ford has been very, very helpful because Ford Foundation actually has been working with Jackie and her team down there. And through that, through the grant that they gave us, we're able to actually work together and get things going. Thank you.
Thank you so much, John. Jackie, you're up next. That's a perfect cue. John has set you up, so you can take it away.
Thank you, Don, and thank you, John, for the kind words. We also acknowledge the Ford Family Program for all the investment that they've made in us, in our team in Nairobi, to enable us to do this work. And as John mentioned, COVID came, and during this time, we had a lot of projects going on. We actually had about 6 ongoing projects. We were very lucky to finish one on secondary education, where we actually went into the schools and interviewed students. But we had 5 other projects, including John's project with maternity spaces and 2 projects with Dr. Wyatt Brooks, who's there, and patient-centered maternity care, and the health baseline study, which is also a study regarding women in Dandora. So how did we adapt our research? So as you know, in places like where we work in Dandora in the informal settlement, it's very difficult for people to afford data enough to have Zoom calls. So we were not able to work on a Zoom platform and do some interviews on Zoom platforms. What we did to adapt was to use normal phone calls. So we have databases of numbers of the women respondents, and participants whom we work with. So we chose telephone calls as a crucial means of communication to stay with research subjects during the pandemic. And since we had been engaging with these women before in person over long periods of time, they were already comfortable with us, and they felt like the phone calls were not intrusive, and they felt very safe talking to us about very personal matters, including pregnancy, issues of delivery. And so this is where the integral human development comes in. We were able to rely on the previous relationships that we had with them. So when we would call them after introduction, they would confirm that we were from the Catholic parish. And so they would say, oh, okay, is that Jackie from the Catholic parish? And we'd say yes, because that's where our base is, that's where our office is. So we were able to even speak about negative aspects of their delivery experience, because they knew that these are people who've been walking this journey with them and conducting research that is transformative, as you can see in the Brother Andre Medical Center, which has really improved services. So the idea that research is a one-off event where you come in and just do research and go did not come with us. So why did our research continue during our pandemic? It's because of such partnerships. I think John alluded to it. We have been building these partnerships since the program started in Kenya in 2011. We've done a number of projects. We also work with partners such as Strathmore University that John alluded to, and working with universities that are trusted in the area makes our work more credible. It's easier to get the permissions. It's easier to do community engagement. It's easier for us to take community members up to the university to show the impact of the work. Then people in places like Dandora are able to trust our work. We also built these relationships over time, and using community engagement as a tool and continuously informing people about what the research does for them has really helped us. So it wasn't only that we were doing research, but it was the relationships that we formed and the partnerships. And we have other partners. I think Augusta Mudingani from the Kenya Conference of Catholic Bishops is on the call here today with us. We have John Mugo and Sarah Mugo of Zizi Afrique. We have similar organizations that have a similar value system to us. They look at the dignity of the human being. So when you build your foundation of research upon such foundations where dignity is the first thing, people really support your research. People remember you. Even if it's just a phone call, you just need a few minutes to remind them that this is Jackline, this is the team from the parish, we're continuing the entrepreneurship study, and they're very welcoming and receiving of this. Then also we have our local partners. The Holy Cross Parish has been an immense support to us. We sit on their compound and we participate in the Brother Andre Medical Center. I used to sit in the board of this hospital, and we've continued that relationship. So it makes it easier, especially since a lot of the women entrepreneurs also go to this hospital, and some of them are our respondents in the study. So we really just really continue engaging with them in these settings. So in summary, we're saying that continuing to have partnerships that are value-based, both at the community level and with outside partners, really helps to do research that is meaningful to people's lives. This research is not without limitations. We've had limitations. The challenges in obtaining verbal consent by telephone. Sometimes it's difficult to start explaining to people that you can drop out if you want. People who are new to the research have difficulty understanding what we're getting at, and we sometimes get people lost to follow up. And then also in ethnographic research, it's very difficult to get the verbal communication cues that you get when you're talking to somebody face to face. There's sometimes a little bit of miscommunication, even with the understanding and the trust. Then there are privacy issues. Sometimes women live in places where they have people listening in on their conversation, and so they're not able to talk as freely. So you hear some commotion, and so we try and get them in appropriate times. We try and adapt by calling them. Then there are basic issues like lack of charged phones, lack of airtime, lack of data. that make the work a little bit difficult. So sometimes you have to make more calls. And I know Wyatt has been experiencing our budget sometimes expanding and having to ask for more money because we made so many calls so many times. Then there's also attrition of respondents. We've experienced loss of follow-up of some women because of the economic meltdown. Some people left the informal settlement to go back to their rural homes. And so it took a while to get them back. And so projects like with Laura Miller-Graf took a longer time because we had to wait for waves of people to come back into the city. Lastly, I think COVID has also ruined the kind of partnerships and relationships we had with potential principal investigators at Notre Dame and in-country partners, which are both requisite for the kind of collaborative research that we do. We've not been able to meet with John and his team and Paul and Wyatt and everyone. So there's a big gap in finding new people to ask new questions. So I think I'll stop there.
Thank you, Jackie. You know, you raised the question of big questions and gaps, and someone's project who had to rethink big questions is Wyatt, who happens to be next. So Wyatt, with Jackie sort of queuing up your presentation, you're next.
Sure. Well, thanks for inviting me to be on the panel. It's great to see everyone. So I wanted to focus on not just the specific situation of what happens during COVID-19, but I think there are actually kind of a lot of generalizable lessons that can be useful for researchers to think about going forward. So first of all, we think of this as being like a big shock, that something like really unexpected happened, and that's certainly true. But I would argue that if you're working in development, then by its very nature, you're working in situations that are very uncertain. If you want certainty, then you got to stay in the United States and you don't want to study development. Because if you think about things like political uncertainty, certainly economic uncertainty, if you're working in rural communities, then even just changes in weather patterns can be fundamentally altering to the situation. And so what you need to be used to as a researcher working in development is that there's going to be uncertainty. Things are going to go wrong. Things are going to go in unexpected directions. And so in every project, not just now during COVID, but going into the future, you need to sort of start out with that mindset that things are going to go wrong. How are we going to deal with it? What are we going to have in place ahead of time to be able to meet that? And that sort of makes me think of, there's this famous quote by Dwight Eisenhower that's the plan is nothing, planning is everything. And I think there's a version of that in research, which is sort of the question is nothing, the questions are everything. So it's like, you rather than thinking about what in this project, what is the single question that I think I want to answer, that I'm just going to establish at the very beginning of the project, maintain all the way through, nothing's going to go wrong. So my research design is going to answer it perfectly. Rather than approaching it that way, you should think about it from the perspective of, what do I find interesting about this particular situation, and what are kind of the realm of questions that we want to explore, and allow from the very beginning for there to be flexibility in your research design to be able to adapt to changes as they come about, and also to sort of be able to be guided by that premise, be guided by what is it about the situation that's going to be there no matter what happens that I'll be able to come after. And then, of course, this is just going to be repeated so many times, I might as well say it as well. I'm sure all four of us are going to talk about it. From the very beginning, every time you're starting a project, you've got to be thinking about what are the relationships that we're building, who are the people that we can rely on, not just now, but in the future, and how do I cultivate those relationships? How do we keep them going over time? So, maybe you're having meetings with people when you're in the region which your research is being conducted, follow up with them. Maybe, out of the blue, send them an email or have a call with them if you can, when there's something that comes up that you think might be interesting to them. Just maintain that relationship, because it's not just about like the depth of a relationship. Like, for instance, you could have a co-author in another country that you have like a very close relationship with. But again, in this very sort of uncertain environment in which your project might be occurring, you also need to think about having broad relationships, because if you're relying on just one person and for whatever reason that one person isn't able to help you in a given situation based on some unforeseeable circumstance, then you need to be able to have other people that you could also fall back on, that you might be able to bring into a project, or whose expertise or resources or that you might be able to leverage. So, and again, this is something that I want people to be thinking about sort of at the beginning of every research project. I don't know what's going to go wrong. The uncertainty, they're the unknown unknowns out there, and so the best preparation I can have to prepare for that is to have a lot of relationships, to try to cultivate them over time, and to take that seriously as actually a very important research objective. And I was going to try to keep it as short as I could, because I want to allow for a lot of time for questions. So I'm actually just going to pause there and let Paul go.
Wonderful, wonderful, Wyatt. Thank you so much, and especially for a number of the graduate students who are watching the panel discussion. The strategy about thinking of relationships as core, and the research design and questions sort of always being in flux and constantly having to wrestle with those is great advice. So we sometimes get a bit narrow-minded in our training, so it's great to be pulled out of that. So thanks for that. And speaking of being sort of pulled out of the more narrow ways of thinking, Paul, with a broad perspective, brings us home as the fourth panelist, and some key issues that he's going to raise about key questions.
Good morning, everyone. I'm delighted to be on this panel, and each of the people that have spoken before me, I respect and delight in engaging with them as colleagues, and I'm grateful for what they have shared already. And in many ways, what I'm going to say builds upon what they've already shared with you. When COVID hit, I was either leading or otherwise engaged in more than a dozen research projects. And so what I'm going to say is, looking more broadly across those projects, the kinds of things that we learned as we tried to adjust to the new reality that was brought upon by COVID. And what we had to do was go through each project and decide through a set of key questions what we were going to do and how we were going to adjust. And I'm going to give you the 3 Ps. And it's not because my initials are PP. I don't have some odd obsession with the letter P. It just worked out this way. We had to decide for each project whether we were going to proceed and what that would look like, whether we were going to pause and defer until such a time as things would be more stable and allow us to make better decisions, or whether we would pivot, the 3rd P. And so I wanted to run you through the series of questions that we asked ourselves that allowed us, me or partners, to determine whether we would take the proceed path, the pause path, or the pivot path. And so the first question, which has already been spoken about by my colleagues, had to do with partnership, a 4th P, which was so critical to allowing us to make this determination. And the partnerships aren't something that you can build after the crisis has happened. They had to exist, they had to be strong, and they had to allow us to work closely and flexibly with each other. And these partners were not only at the field level, but also looking back at the donors and those who were supporting this research, and having that dialogue with them and having that relationship with them that would allow us to open the space for talking about which of these 3 Ps we felt was the best course of action. So partnership was the first thing that we looked at. Who are our partners? Where are they? What are their constraints? What are their realities? And what are their opportunities that allow us to think about pausing, proceeding, or pivoting? The second thing we looked at was the questions around whether our research questions were still viable, or whether they were affected by this reality in such a way that we needed to rethink our research questions. many of these projects that I'm describing were embedded within projects, implementation projects, development projects. And I see my colleague Danis Guzman is on the line, and she can speak very deeply about one of our projects that was embedded within schools in Haiti. And as we know, schools were one of the first things to be affected by COVID. And so we had this really nice, well planned out, well designed research project embedded in schools. What do you do when the schools close down? How do you adjust to that? How do you test literacy? And so that exploring alternative questions was an important part of making that decision and making that pivot decision in this particular case. We asked ourselves what would be the safest way to collect the data that still allowed us to answer our questions. So that was the next set of questions we started to ask ourselves. And in many instances, that involved pivoting to remote data collection technologies. And what that was varied by project. What was the best solution for the context, for the people that we wanted to engage with? In one project, we used Skype in some places, we used Zoom in other places, we used WhatsApp, and we used telephones, all within the same project. That allowed us to collect the data remotely without putting anyone at increased risk and without necessarily too deeply compromising the quality. We've also used online data collection for surveys with Google Forms, with Qualtrics, and other approaches in that way. We have used remote techniques to train enumerators in the field. And John has already mentioned Miro, which is a digital whiteboard that has allowed us to facilitate workshops remotely without needing to put anyone at increased risk. We also examined for each project, are there existing data sources that we could tap into to complement what we were trying to do with primary data collection. And then another set of questions we asked ourselves was, if we felt like we needed to proceed with on-the-ground data collection, working with our partners, what was the safest way to do that? How could we follow existing protocols in country? How could we avoid introducing outside community members into a community? So leveraging people within a community without bringing outside people, which at the time would be very concerning to communities on the ground. And, you know, COVID just, I think in many ways, made it more difficult for outsiders to go into a community and collect data, just because of the additional burden that COVID and that mistrust and fear put on the situation. So working with our partners to see, can we make sure that we have local people collecting local data? And if not, then we have to think about something else. Can we ensure that we can provide protective equipment to the respondent and to the interviewer? If not, then we need to think about something else. And then the final piece was, how do we reallocate resources? We have, all of our research projects have plans and they all have budgets. With the new realities and all of these questions that we had to ask ourselves and changing methods, changing questions, how do we make it fit within the budget? Or do we need to go back to the donors and ask questions about that? And so running through these series of questions has actually allowed us to continue doing research and asking questions, and I think even deepening some of our partnerships on the ground. In some cases, we've had to pause our research, and in some cases, we've had to reformulate completely what we intended to do. But I do feel like we continue to do valuable research that allows us to gain insight into the dignity and lives of people that we are hoping to influence. And so with that, I will turn it back over to Don.
Paul, thank you so much. 4 really great presentations in a very short amount of time. You guys are awesome. And we have a couple of questions already coming in for the group. The first question is actually from Annie Foley, one of our Kellogg International Scholars. And this is something that everybody is going to be able to weigh in on. Annie's question is, what are some strategies for establishing mutual trust and rapport between the researcher and the interlocutor in a virtual setting. So looking forward into a possible more virtual setting, how do you create the kinds of relationships of trust that you've been able to do on the ground? What are some strategies for doing that virtually?
I have a thought on that. So I was actually in the middle of data collection when COVID hit, when the university closed. And so even within that week that I was on the ground, things just completely changed. The reality changed. And so even within that week, I had to transition to remote data collection. And what I found was helpful, these were more qualitative interviews, but I think it might apply also to quantitative, was before diving into the interview, I spent some time more informally talking to the people that we were interviewing, getting to know them, learning more about who they are, where they are, about their families. Like, researchers don't tend not to do this, but I just felt like it was important because we weren't face to face and because I wasn't with them. And I do believe that helped, at least in these particular cases. I'm not sure if that would work in every context, but this was a culture and a society that valued warmth and connection. And so I just built a little bit of extra time at the beginning to just talk without first diving into the interview.
Yeah, that's great advice. I guess I would also add to that we sort of shouldn't kid ourselves that it's like that there is going to be any technological solution that's as good. So we should take seriously that, like, this is a difficult time in which we're going to have to be doing something that's sort of second best. Now that said, we should also keep in mind that in essentially all parts of the world at this point, most people have cell phones, and cell phones are a very common means of communication these days. It's how people are communicating with their friends and family quite commonly. And so maybe, this would have been an even bigger problem 10 years ago, where, first of all, people not having cell phones, but on top of that, digital communication being less common. I think probably these days it's a little bit easier to initiate a conversation via text or WhatsApp, follow up with a phone call, and have that be sort of, usual and also expected form of communication. But like I said, I do want to emphasize that when we can get back to interpersonal communication, we shouldn't think of these digital solutions as being as good.
Wyatt, oh, go ahead, Jackie.
Sorry, Don. Thanks, Wyatt. I just wanted to add on to what Paul and Wyatt mentioned. When you are doing research, I think one of the strategies to improve mutual trust is to respect people's time. Just because people are in a virtual space, it doesn't mean people have all the time. So you keep the time. If the interview is supposed to be 45 minutes, don't go overboard, because people are using that time for something else. And then the other thing is keeping our word. If we said that there was a disbursement we were giving in a certain time frame, you give it when you say you'll give it, because that reciprocity builds trust. When you say something, you do what you say, because after all, you're a virtual voice out there. And if you've not known each other or you're recruiting new people, it becomes very difficult, because in the setting of phone calls, they're telemarketers, there's all kinds of people calling people. So sometimes people's responses are off. So you need to keep time, you need to keep your word, and you need to be consistent in how you engage with your populations.
John?
Yes, thank you very much. First of all, I would like to highlight that support that we had is actually from Doug and Kathleen Ford family, not Ford Foundation. So I was wrong with that, and I apologize to them. And I really want to make sure I thank you very much for your support, because without you, we couldn't get this going. Secondly, just what Jackie has just said, and Paul and Wyatt, it's very, very important that we have a track record. And you only have a track record by building this continuous relationship, building trust by keeping your word. If you don't keep your word, they won't trust you, because we live also in an age where there is so much misinformation out there. There's telemarketing, there's misinformation, People, sometimes they don't trust you. So you have to make sure that they know who you are. Be open to them about things. Tell them who you are, where you're coming from, and what benefit they'll get from doing this research. Because they'll wonder, why should I do this for you? What do I get out of this? What do you get out of it? So make sure that they know that personally there's nothing you're getting out of it other than trying to learn and improve livelihood of everybody else.
Mhm. Fantastic. You guys are awesome. In fact, the questions about moving forward and tapping into your expertise are continuing. Patrizio Perrin has asked a question that was also asked earlier. It's come up a couple of times, so we'll add it in right here. And the question is about what you've learned and how you're going to implement that moving forward. The question is, how have the innovations and adaptations of your research required by the COVID pandemic led you or revealed new approaches, new methods that you think are worth employing after the end of the pandemic when we get to the new normal? Who wants to start us off?
For me, I think one of the things that we found very helpful, like for example, Miro and other digital whiteboards, we began implementing this at least the moment the pandemic hit at the school level, because in design, we have to interact with the students directly. It was very challenging. How are we going to teach design studio without access to students directly? And this has really helped us a lot. And it helped us to translate from that platform of interaction with students into research. And it's something that I think we'd like to continue working with. And I'm assuming that because of this, it's going to improve a lot more, where we're able to interact almost directly with the respondents, people we're dealing with directly, where they can see you putting things directly and move them around along the way we normally would do on the ground. The challenge that sometimes you have is not being able to see their eyes as you move things, because sometimes their eyes can tell you things that the words won't tell you. That direct interaction is lost in the digital format. So it's a challenge in that sense.
Excellent. Thanks, John. Wyatt, what do you see moving forward? What would you take forward?
So for more quantitative studies, I think one thing that has always existed but hasn't been used as much is this kind of model where you have your initial meetings with study participants in person, and then you follow up with them by phone call, and you do follow-up surveys that way, which is actually logistically much easier, especially in places where it's difficult to get around. But that's been sort of experimented with in the past, but there hasn't been like a well-developed body of best practices on how to implement that. But given what's happened this year, all of a sudden, essentially all quantitative field projects are done that way. And so in the coming years, we're going to be able to look back at all these things, and throughout the sort of research community, we're going to build this sort of great body of best practices where people tried different things, implemented in different ways, and had more or less success. And we can use that to be able to do these follow-ups a lot more efficiently, which is actually going to be great because, like I was saying before, given the ubiquity of cell phones these days, even in very poor countries, that's going to make it much easier to gather data and conduct research in general.
Thanks, Wyatt. Paul, you've already touched on some of the things that you pivoted on and implemented structurally or institutionally. What else would you take into the future?
Yeah, so I would agree with what Wyatt and John just said, but I want to underline with red marker, no, not red marker, a red pen, underline the importance of partnership. It's interesting that COVID has spread us out and split us and limited our ability to connect physically, but it has truly really revealed the importance of partnership. And I feel like, at least in development research, the idea of a researcher sitting alone behind his or her desk with books and pens and just leading a research project without leaning on anyone, I just don't think that model works in an era such as this. And I just value even more the importance of good partnerships in country and true partnerships, not just a researcher at Notre Dame telling people on the ground what to do. That's not going to work either. But with Jackie, I think Jackie's a perfect example of an incredible partner on the ground who has moved heaven and earth and made things happen that none of us could have done. And so that's what I would say. It's just taking that with me and saying this is critical moving forward.
Thanks, Paul. Jackie, you're on the ground. Your perspective is going to be fantastic at this point in terms of adding to what John and Wyatt and Paul have already laid out.
Mm-hmm.
Where do we go?
Yeah, I think I concur with my colleagues. Thanks for the kind remarks, Paul. I think what Wyatt and John and Paul are saying is the whole idea of partnerships, and even whether you're using the phone or Zoom or just talking to people in face, people remember you for who you are. What are your values? For me, what pulls it together is the dignity of the individual. Even if you're doing research, people want to be seen as human beings. And so the foundation that we put in the programs early on with support from the Fords, who we're very grateful to, and Father Bob, who had this vision that we're not going to do it in a hurry. We're going to understand people. And so we've had a changing landscape of partners at the community level from one community, and taken that value system to outside partners in the way we choose who we work with, whether it's CRS, Zizi Afrique. We just don't work with anyone, whether it's Strathmore. We say that these people have the same values as we do. They put the human dignity first, and that brings about the integral human development in practice. So it's just not about the research first, because research you can do, but the next time you go to people, they won't talk to you. They'll be like, you came here, you took our data, you wrote a story in this journal, which doesn't concern us. Research is about people's lives. So I feel like we got the bet right when we started doing research this way. And people ask us, how is it that you continuously work in this Dandora and you're not chased away and people are not violent towards you? But it's that understanding. We even had Dandora women go over to Strathmore University, and they said it was their first time to step into a university, and Strathmore University let them get into their university. So that idea that they were not just respondents, but we were working on the entrepreneurship problems of our day and bringing in stakeholders, the women were stakeholders, made them, they forever remember that. If you go to Dandora, they say, these people made us step inside a university. We thought that was an ivory tower for different kinds of people. So I think, just to wrap it up, I think we really need to keep true to the idea of people's dignity, and that this is about people's lives, and research is, we're trying to answer these questions, but first let's treat people as people, even as we get these answers.
Jackie, you raise a really interesting idea that I don't want us to miss, this idea of almost a shared commitment to these critical values, and that shared commitment and partnerships really come out of engaging over time and having relationships. So, where I think some might look at partnerships and relationships as interchangeable, in the course of the conversation, it really sounds like what you and others are describing is that partnerships rely upon relationships, that there's a certain sequence and an individual connection that can't be discounted. Is that fair?
Yes, it is.
Okay, great. Because I know we've invited a lot of graduate students to join us this morning to think about their own research and how these strategies would implement them. So I just want to make sure that they're clear on that too, on how those pieces go together. So thank you for your patience on that. We had another question that came in, and it is a question about, let's see, it looks like this one is directed to Wyatt specifically, but invites all of the panelists to join in. And this is from Marianne Botchaway, the program director at the Eck Institute. She asks, can you talk about your ability to navigate, study, and research flexibility with the IRB requirements and approval? So how do you factor IRB into this process as well?
Yeah,
Wyatt,
absolutely.
go ahead.
Yeah, so we were extremely fortunate in the COVID project that for like long story reasons, it happened to be handled by the Yale IRB because one of our co-authors on the project is at Yale. And Yale actually opened a special facility for COVID-related research where they were guaranteeing 48-hour turnaround on responses to modifications to protocols. And they actually responded in less than 24 hours. So they even beat their 48-hour estimate. And they responded with questions, like they responded with like, here's our feedback to the changes you want to make. We implemented those, and then they approved it very quickly. And so at kind of an institutional level, that was just luck on our part that we were working with an IRB that was willing to be so flexible. Certainly not all universities or all IRBs are willing to do that. In general, so obviously, it goes without saying that you have to be in contact with your IRB, have a relationship with your IRB that's ongoing, and make sure that everything that you're doing conforms to the protocol that you have in place. If there are things that you need to change, then most IRBs are open to amendment and modification. And it requires planning ahead. That's like the biggest problem with IRB, is that you'll really get into trouble if you leave it to the last minute. We're going to the field next week. We need to make all these changes to how we're doing everything. Hey, IRB, will you respond instantly? The answer is going to be no, and you're going to be in big trouble. So, you know, this is like the really nitty-gritty part of doing research, is you've really got to plan ahead. You've got to be careful in how you do these types of things. And I think having a sort of ongoing relationship with your IRB where you have a sense of like how to anticipate the types of issues that they'll be asking about, and like what the timelines for meetings are and so on, what sorts of things can be expedited and what things can't. That's really important as well. So yeah.
Wyatt, I can't resist here. I have to ask. So to pick up a common theme, one also has to think about a relationship with the IRB, right?
Okay. Yeah, that's exactly right. Yeah.
Paul?
I think Wyatt hit the nail on the head. I don't really have much to add. He articulated it perfectly. Just making sure you build the time for it and making sure you're communicating.
Okay, great. Thanks, Paul. Jackie?
I don't have much to add. I think you just need to do the things that are required. Like for COVID-19 in our setting, we got all the protective equipment, and we ensured the institutions where we were working at the parish, there was a temperature gun. You know, for the studies that had to continue in person, we really took into account the government of the day's instructions on COVID, because there were different instructions from in-country. So we just inform back that, you know, the rates are high, let's still break. And when the rates started falling and people were now, you know, the curfews got shorter, we followed the instructions in the country, and we just stopped for a while. We actually stopped our studies for a while.
Okay, thank you, Jackie. John?
Yeah, I think I agree with Paul and Jackie and Wyatt. It's all about time. Factor this time in. If you don't factor the time in, it's going to give you problems. And be patient. Communicate with them, ask questions. If they ask you questions, respond to those questions. Because there are reasons why they're asking those questions. Sometimes because you're not very clear to them, or sometimes because they just don't think we understand the background clearly. So in which case we need to respond to them. So it's about time. Factor that time in and respond and communicate with them, reach out to them all the time. IRB are very helpful. They're here to protect us, protect you as a researcher, and to protect also the people you're working with. So it's very, very important that we work together with them.
Thank you, John. We're almost out of time, so we have our final question will be sort of a lightning round question. And the question has to do with IHD research. And the question is, how have the innovations and adaptations of your research required by the COVID pandemic affected your understandings of IHD research? So we'll do lightning round. Paul, we'll start with you.
Well, I just would build up upon something that Jackie said, that we can research IHD, but we can also live it in the way that we do the research. And I think that COVID has really underscored that. We're all experiencing this, we're all human, and we're all longing for human connection. We're longing to be seen and heard and loved and respected. And so that's what I would say, is that we as researchers embody those ideals in the way that we carry out our research, not just in researching the idea itself.
Great, great. Thanks, Paul. Jackie.
Thank you, Don. I think my understanding of IHD during this period of COVID came around when we were able to witness the kind of vulnerability that was in these communities. A whole group of people just disappeared, as a coping mechanism to move from the informal settlement to the rural areas. And, we were calling them and they say, I'm not back in Nairobi. And one of the key results we found in one of our maternal health studies with Dennis and Laura Miller-Graf was that people said that food security and social safety nets were the most important thing they wanted from the government, not even the curfew, not even the disease. So once you speak to people and put out that information, you start to get a very different thing from what traditional research is saying. People just need their basic needs met, their dignity, their safety, the social safety net, food to eat, and the vulnerabilities like employment met. So we got a lot of that. People said we're not scared of COVID, we're going to die hungry in this curfew. So we were hearing things like that, and I think we wanted to communicate that out to policymakers in the form of papers, that really, when a pandemic like this hits, it's the things that affect the human dignity that are most important. Forget telling people to wash their hands and all that. Yes, you'll tell them that, but also please take care of the underlying needs that are making them feel vulnerable from day to day. So that's what we really got from our respondents at a very personal level.
Thank you, Jackie. John.
It's very interesting looking at this, and as Paul pointed out, that research of this nature is about people. If you're in engineering or in biology, sometimes the research is about the instrument you're working with. It's very instrumental, so you don't really worry about what happens beyond the impact. It's very, very limited in use. So if pandemic heat doesn't matter, as long as you can work in the lab, you're okay. In our case here, what this is teaching us is we're all the same, we're all vulnerable. I mean, when I was talking about traveling to Kenya, people are saying you can't, it's not safe. So, you look at all those issues, and if it's not safe for me to travel there, it's not safe for them to go to the clinic. And then how do we find ways to talk to each other? So we need to treat them with a lot of dignity, respect them, think about protecting them. Don't put them in places where they'll actually get vulnerable, get injured through our process. So we have to look at those and find ways of meeting them where they are.
Thank you, John. Wyatt, the last 30 seconds are yours.
Sure. So I talked a lot about flexibility and sort of making compromises, or being willing to change your question. But one thing that you can't change, of course, is your values and like what values you bring to the project. And so when you're thinking about some situation arising and needing to make changes, as Jackie was saying before, trust is so key. Following through is so key on anything that you've promised. And, if you've made promises to the community and it's going to compromise your research design to deliver them, you have to deliver them nonetheless. And that's a key thing. Like before you're a researcher, you're a human being. And so you have to make sure that you're following through on your commitments to the other human beings that are part of your study.
Thank you, Wyatt. Thank you. We are out of time, and I thought we might hit the 10 o'clock hour pretty fast with the kind of conversation we have. We still had some unanswered questions in the queue, and I thank those folks for the questions. We'll actually be sharing them with all of our panelists so that you can get a response. And we may actually continue this conversation given the interest in the future and have our panelists back for more questions and answers. Before we close out, please join me in thanking our 4 panelists, John Onyango, Jackie Aridi, Wyatt Brooks, and Paul Perrin, for an excellent panel discussion. We'd also like to thank Doug and Kathy Ford for their shared commitment and support of this important work. Without them, the Ford Program in Human Development Studies and Solidarity would not be possible. If you'd like to learn more about the research of our 4 panelists today or other projects sponsored by the Ford Program, please take a look at the Ford Program links in the Kellogg Institute website. I thank you all again for joining us, and I wish you a great morning and a great weekend. Again, thanks to all.